Hi, I'm Johnny Harms, and this is my friend Dylan Greco, and today we're going to discuss about diabetes and more specifically type 2 diabetes and how it affects the body. And so Dylan, your dad has diabetes, correct?
Yes, he does.
Just regular type 1 or type 2?
Type 2.
He has type 2.
Yes.
Okay, perfect. Do you know about type 2 diabetes? And
Not really. I don't really pay too much attention to it, but yeah.
Perfect. So we're going to explain a little bit more about type 2 diabetes today and how it affects them. So without further ado, let's get into the video.
Okay, so first we're going to start by saying what diabetes is. Diabetes is a chronic disease in which the body cannot regulate insulin properly. That means glucose levels soar, and this is due to the pancreas. So the pancreas is not able to secrete enough insulin, which results in the blood glucose levels rising. Now, for an example of this, I have a glass of water with ice in it. So as the ice melts or decreases, the level of water increases. So if you label the ice as insulin and the water as glucose, in a normal body, there's a perfect balance between ice and water. But with a person with diabetes, there's a balance. So as the ice decreases, which is the insulin, the level of water increases, which is the glucose, and that's exactly what happens to diabetes.
This visual aid will help explain the glucose and insulin within a normal body regulation and a body with type 2 diabetes.
The first example is of a healthy individual. This healthy individual has a perfect balance between insulin and glucose. These big areas right here are the insulin, and these small areas are the glucose. As you can see, there's a nice healthy balance. But if we go down to the second example, this is someone who suffers from type 2 diabetes. As you can see, there is a very, very abnormally high amount of glucose. This is due to the pancreas not being able to secrete insulin, so this means that the blood glucose levels rise. So there's one insulin, there's another, and the rest of these are just glucose.
So Dylan, there's pretty much three main causes of type 2 diabetes. The first one being insulin resistance, which the cells being less responsive to insulin. The second one is the pancreas no longer secretes enough insulin. And the third is there's no insulin at all. The pancreas stops secreting insulin at all, so just have no insulin. Okay, Dylan, so these are some common signs and symptoms of an individual with type 2 diabetes. The first being numbness in the hands, fingers, or legs. The second one is increased urination. The third one is weight loss. This is due to the body not being able to absorb glucose properly. The fourth one is appetite, or increased appetite. The fifth one is blurry vision. This occurs as glucose levels spike, damaging blood vessels and fluid in the eye. The next one is diabetes affects sweat glands, so often people get dry skin and their skin gets affected by having diabetes. The next one is the seventh one, and it's unexplained fatigue. The eighth one is, again, it goes kind of with hand in hand with urination. It's dehydration, and so people with diabetes, and especially type 2 diabetes, are often quite thirsty, and so they always need to quench their thirst. And last is slow healing cuts or bruises. This is because the high glucose levels weakening the immune system and slowing down the rates of healing. Just got that? Nine common symptoms. For the long-term complications, I gave Dylan this handout that clearly explains all the risk and complications that go with diabetes.
So starting at the top, diabetes causes issues in the brain and how it functions. These lead to strokes. Next is the eyes. Eye problems are a potential complication of diabetes, and the light can bother your eyes and it can cause potential blindness. Next is the heart. Heart attacks are a huge risk in diabetes. Often, many times people die from type 2 diabetes because of heart attacks. The blood pressure and cholesterol are harder to control with diabetes, and so that's where the heart attacks come in. Next is the kidneys. Kidney disease is a huge area with diabetes. Kidneys might not work as well and may even stop working with diabetes, and so you might need a kidney transplant or something that helps your kidney function properly. The male organ system actually is affected by diabetes, and it can not allow men to get an erection, and so obviously if you're trying to have a child, that could become a potential issue. And so that goes along kind of with nerve damage, and that's kind of all over the body is that nerve damage. So nerve damage, it's damaging nerves and causing pain, tingling, and loss of feeling in the body. And again, erectile dysfunction in males. Next is feet. A lot of times patients with type 2 diabetes get sores and infections in the feet, and if this goes on too long, the foot or leg may need to be amputated. So a lot of times people with type 2 diabetes are amputees. And last is just infections and itching all over the body, and this again is more like skin related, as we talked about earlier. So people, obviously, like males, have it mostly in their sensitive areas, and so the prevailing scratching and but scratching all over the body is very common with people in type 2 diabetes.
Okay, Dylan, so after our discussion about diabetes and all that we've learned today, what was one thing that really stuck out to you and you found interesting?
That is pretty interesting that you could lose a foot if you have type 2 diabetes.
So there you have it. So from Johnny and Dylan in St. Mike's 225, that's all.